Welcome back to Hardball. President Obama is preparing to give Congress details about what he wants on health care reform. It's going to be a big speech to their joint session next Wednesday night. But the largest labor union in the country, the AFL-CIO, has already warned Democrats that they'll pay a political price if they abandon the public option. Richard Trumka is Secretary-Treasurer of the AFL-CIO, and he's expected to become the president of the AFL-CIO within a matter of weeks. Thank you, Mr. Trumka. You're a great guy.
Thanks for having me.
We look at a situation in this country which is terrible for the working family. We have an unemployment rate as of today of 9.7. It's going up over 10. The mayor of Philadelphia, I just talked to him, Philadelphia is about to face thousands of layoffs because the state legislature will not deal with the problem they have of trying to raise some revenue. The country is really on the skillet right now, and at this very time of tension and bad times, you are insisting on your version of the health care bill at the risk the president will get nothing. Why are you playing so tough?
Well, first of all, what we want is health care reform. There's no sense in getting a bill that doesn't fix the problem. We have a crisis. Every 30 seconds in this country, somebody declares bankruptcy because of medical bills. 94% of the markets, health insurance markets in this country, are classified as highly concentrated. That means we have to have some way of breaking the stranglehold that those insurance companies have over the health care market. The best way to do that is to have some competition for them. It'll make them more efficient, it'll make them more innovative, and we'll get a better deal. And it'll give us some place to walk. Look, right now...
When did you come up with this? When did this become a hard and fast rule for labor? When did you decide that unless you have a public option to private enterprise, we can't perform in this country? We can't deliver services without a public option. When did you come up with this?
Here's what we said. All along,
last week, last month?
Forever, we've said we want health insurance reform. It doesn't work in this country. And whenever the bill kept getting, or the debate kept getting narrowed down, they came down to the point where if you take the a public option out, you don't have health insurance reform. You won't have anything that'll keep the insurance companies honest and give everybody a chance to walk. Look, right now, there was just a study out in California. Insurance companies are denying over 30% of the claims that come to them. So your doctor prescribes something for you, but they say no. Yeah. The insurance company says, no, we won't pay for it. You have nowhere to go. With the public option, you have leverage on them. You can walk with your feet. You can vote with your feet. It's a chance to break the stranglehold that they have on 94% of the insurance markets in this country.
Can you pass a bill like that?
Absolutely.
How?
We're working at it.
And where are you going to get the votes in the Senate?
Well, I think the president coming out helps us.
You think you can get 60 votes in the Senate?
I do.
Where? Name the Republicans. Name one Republican.
No.
Okay, name another one.
Well, we don't need another one, do we?
So you get every single Democrat who support the public option, even though most of them, up to 5 or 10% of the senators saying they're not going to do that.
Well, we're going to help them do the right thing.
Ken Conrad, the head of the Budget Committee, said he can't do it.
We're going to help them do the right thing.
What, are you going to pummel them? I mean, what are you going to do to make it happen? These guys say they can't do it.
They can do it. They choose not to do it. That's what we've had in health care across the country for 25 years. They keep saying, we can't do it. They can. They choose not to. It's time for them to keep their promise to the American public. They said
these fellas and women represent states that don't even have right-to-work laws. You got people representing states like Louisiana, Arkansas. There's a lot of states that have Democratic senators who have a hard time making these liberal positions.
It isn't a liberal position.
It isn't?
This is supported by Republicans, Independents, and Democrats. Look at the support for it. Now, they came out and tried to muff it up and tell lies about it and do everything they could to destroy it. But as we get the facts out to them, the support is growing, and we...
Okay, imagine you're Blanche Lincoln in Arkansas, and you watched for the last couple of elections the Republicans sweep your state by double digit, and you're now going back to your state and saying, I'm voting for the labor position on health care.
Well,
I'm going all the way over that far.
It isn't the labor position.
Would you rather have nothing?
And you know better.
Would you rather have nothing?
You know better.
Would you rather have nothing?
Nothing or what?
Nothing, or a bill that has a trigger in it to bring in a public option if necessary.
You can make an argument that if you're not breaking the stranglehold of those insurance companies, you're getting nothing.
Okay, Olympia Snowe, the Republican you mentioned, is the 60th vote, and perhaps necessary vote, perhaps, depending on the procedure they follow. She said she needs to have a trigger. In other words, it can't be a public option right away, but if the insurance companies do what you say they'll do, there'll be a public option.
They could. I'd like to see the details.
Could you live with that?
No, I don't know the answer to that, because I don't know the details of it. What we've said is, show us a way to break the stranglehold that those insurance companies now have on 94% of the insurance markets in our country, and we'll take a look at it.
You ever think about the fact that we get gas, we get electricity from private sector people, but they're public utilities, and they're completely controlled by the local governments? Why don't we do something like that with insurance companies? Just make them public utilities. Why don't we do it? We can't screw people. You got to deliver.
We would consider it.
I think so. I wish we could. I'm with you on the bottom line. I worry about the politics of this, Richard, because I worry that even though you've got big labor behind you and you have a lot of strength out there with these Democratic members, that we find ourselves in around Halloween or Thanksgiving, and you can't get a bill through the House anymore because they don't think the Senate bill's good enough, because the Senate bill's not good enough. You won't even get the first House to pass it because they're looking at the Senate. And we're going to have a locked box here, like in a traffic jam, where nobody's getting through it, and Republicans are in heaven because the party that's against the president and wants him to fail will be ecstatic and laughing at the Democrats. They'll be laughing at Nancy Pelosi and you. You guys played hard guy. The president went down. Who won? They won.
Well, let me make a...
By the way, Bill Clinton's talking. I'm not talking. Did you hear what Bill Clinton said?
No, I didn't.
If you don't have a bill, you lose.
You lose what?
You lose politically.
Well, I think there's a lot of truth to that. I think there is. But if you have a bill that doesn't work, I think the American public loses. One of us every 30 seconds declares bankruptcy because of those health care bills. We have to have something that changes it and breaks the stranglehold that the insurance companies have on this country right now. That's what the American public wants, and I think that's what they're going to get.
Good luck with that.
You're going to get a great bill out of that.
I'm with you in spirit. I love what you're trying to do. I think the American people deserve health care, accessible, affordable for every American. I love the idea, and I think even a lot of the Republicans, or some of them, buy the principle. We'll see how they vote next.
We'll see if they put their money where their mouth is.
Well, let's see if they applaud next Wednesday night. Anyway, Richard Trumka, good luck in your election. It's going to be a close one. It's going to be a real nail-biter for you. Anyway, congratulations, probably. Anyway, probably the next president of the AFL-CIO, which is an honorable position in the tradition of George Meany and Gompers, the big guys. And you can